Hello, Paige. So many favorite peeps that we have in this industry.
I was going to say I have to look at it.
No,
We
good to
have
see.
almost 1,500 that are registered. So I am, everybody's muted out. We can see your chat stuff. I will shut that off, while we're presenting, and then we'll switch to the Q&A. I am also live streaming this on YouTube, because as we have overflow, we'll be able to they'll be able to catch it. It will also be recorded. So just so that way everybody knows, and we'll go ahead and we'll get that started in a couple of minutes, but I want to get everybody in first. But let's go ahead and as we ramp up. Karen, you said that you wanted to add a question. What's the question that you wanted to add? Because odds are it's probably one of the 10 that we're going to talk about. And for those of you, if you do not follow me on social media, I highly recommend that you do, so that way we can make that happen. Okay. Did Doge make cuts to CMS? They cut everywhere. So yeah. Everybody wants to see your necklace, Danielle, and I was actually scoping that out
Oh,
also. I'm like, oh my God, that is awesome.
thank you.
You have some of the best pieces.
Appreciate that. I love to support other female business owners, and there's a lady here in
Yeah,
Fort Worth. She runs a place called Mustard Seed Jewelry. You can find her on
right.
Facebook. She does live sales on like Tuesday nights. She's awesome.
Okay. I see the posts and I actually have a screenshot of a couple of pieces that a couple of sets of earrings that I have to look into. Okay. Okay, so we're gonna go ahead and give it a couple minutes. I usually go ahead and do a couple minute delay just so that people that are dialing in or in case there's any kind of issues that we can go ahead and do a slow ramp up, and then I am also going to turn off the chat now. So hold on a minute. Okay. Okay. So now if you want to ask questions, you can go through the Q&A. But we're the noise that happens with the chat normally through my stuff. I want to see the questions coming through, but I don't want to go ahead and have it where it's disruptive to all of you. So this way I can watch it and go from there. I am going to go ahead and record this. So let me go ahead and hi, everybody. Thank you for joining in today. We are going to talk about the future of Medicare. My name is Amanda Brewton. I am the owner of Medicare Answers Now, and today joining me is Danielle Kunkel Roberts of Boomer Benefits. Thank you, Danielle.
Of course.
We are going to record this. It will be posted on the on my YouTube channel, which is Insurance Unfiltered. And we are going to go for the full 2 hours. So this will run until 3 o'clock so that way you are getting the latest and greatest information about what's going on. Um, we were talking and how this webinar came about was is that there's so much misinformation right now and the media is doing one hell of a job with basically scaring the hell out of people. So we wanted to jump on, which is pretty typical that about July, August timeframe. We get on, we do a webinar just to say, okay, this is what's actually happening. Here's what you need to know. And specific to this one, in the registration, we asked you flat out, shoot your shot. What's the question that you want asked or and answered? So we took The 1,500 plus responses that we got, I sat there last night, and for about an hour and a half read through every single one of those questions, or in the statements. Some of you said that you don't have a problem sleeping at night. Congratulations to you. Others of you had to, there were some pretty common questions that were there. Um, and that was good. And I had a couple of other funny comments that were put in, and I appreciate those. And those of you that said that they appreciate me, thank you. I love you too. But today, what we're going to do is we are going to delve deep into these 10 top questions that y'all want to know about. Um, as I mentioned, I am going to record this. It will be on my YouTube channel. We are also I'm on a YouTube live also filtering this through. The other piece of this is that these are your questions. So don't multitask. Please pay attention. We're going to break this down so that it's not over your head and it's in English, which is typically our style to do, is to give it to you straight and to cite the sources so that that way you know how to learn and where to go. And I hope that you find this informative and it's able to ease your mind, because hands down, the number one thing that everybody was worried about is, am I going to have a job? And what are the commissions going to look like? So we will definitely be talking in depth about both of those subjects today, along with quite a few other things. So I am going to go ahead and share my screen. Let me go ahead and do the slideshow. And okay, can somebody sound off in the chat and let me know that you see it? Perfect. Okay. Awesome. I appreciate you guys for going ahead and let me know. So who are we? I'm going to go ahead and if you whip out your phone, you can do the QR code to connect me through all of the social media stuff. So check that out. There's a couple of places in this webinar that there'll be QR codes that you'll be able to connect to various things that I want you to know about. But many of you have followed me for a few years. For some of you that are brand new to me, as I said, my name's Amanda Brewton. I am the Answers Now, which is a FMO out of Cleveland, Ohio. I am also the creator of the Ms. Medicare conference, which just ended last week. I also do Medicare Margaritas, and then I am the creative director and sponsor, or creative director and partner for the Agent Symposium of Medicarians, which is the industry's largest trade show that has approximately, well, this past year we had 4,400 people that attended. So that's a little bit about me, and I'm pretty heavy into the advocacy work on everybody's behalf. So specifically with one of our professional organizations, NABIP, which you guys will hear about soon. Danielle, you want to introduce yourself?
Sure. So I am Amanda's insurance bestie, I think, and we've rocked a number of webinars this last couple of years. I'm one of the founding partners at Boomer Benefits. We just celebrated 20 years in business. We're in Fort Worth, Texas, but we do business nationwide in every state except for New York. And I'm very involved in NABIP. So I've been a member since 2007, I think. Has served at the local, state, and national level. And I just finished up 4 years on the Medicare Advisory Group, the last 2 years as the chairman. I've recently handed off to the very capable Chaylin Jackson, who will pick up and run from there. Amanda will also still be serving on the Medicare Advisory Group with we had some great agents come in and that we were able to appoint to the group. So one thing is Amanda and I love legislation. That was very easy for me to plug into at NABIP, but I love to be involved in everything that has to go with how policy is approved. And I'm heavily involved in advocating for Medicare beneficiaries on a national level. So I go to DC a couple times a year. I'm working on a client case right now with a legislator that had a $40,000 bill in the 1 month COBRA between when they left their job and when they started Medicare, which was a little too late. And so I'm trying to get that resolved. And that is how far you can literally go in this industry with what you do for your clients. We're going to talk about a little bit about that today. There's an upcoming webinar that NABEP has so you can learn to do the same. And we've got a lot of great stuff for you today.
Yeah, the whole goal is to really empower you guys with the knowledge and some actionable things that you can do to help. So this is not just one-sided. There's a lot of different things that we're going to throw on the table, so that way you have some alternatives with things to do. So the whole goal of this call is, as we mentioned, it's to address the rumors within the agent community, to provide a place for you to ask your questions and get some answers. Chaylin and I actually did a session at NABEP's annual conference in Miami a couple of weeks ago, and we had standing room only, and it actually went into the hallway with how many people had questions and concerns and things like that. And I thank him for going ahead and taking the time and doing that with us, because we did it on the fly. I mean, it was just, we changed the topic and went, less than 12 hours later, okay, game on, let's do this. But the whole goal is to go ahead and educate you guys and make that all happen. Again, I do ask that you stop multitasking as we're talking. We will talk pretty quick. I know most of you go ahead and have issue, you like to multitask, but then you're not really going to sink in the information. And this gets a little technical, so I do want you to be able to really hone in on what we're talking about, because this information you can then go back to your beneficiaries and your clients and even your centers of influence to be able to talk about these things competently about what is happening and disseminate a lot of this bad, or, contradict a lot of the bad information that is out there. So, okay. The first question that we got, and I actually pulled the direct quotes out of the actual registration. So it's, how do we as agents make sure that CMS and the insurance carriers need us to educate beneficiaries? Does anyone have the hotline to Dr. Oz to explain the importance of brokers and how some of these carriers are unethically acting? So with that, many of you, or a lot of people, don't realize that we actually, because you carry E&O, there are professional organizations. We are considered professionals, just like a lawyer, just like a doctor. We have that level of intensity. I guess that's what you want to call it, or professionalism. So there are three major organizations that speak on behalf of health and life insurance agents. There are more, and that list is long, but these are the three big ones. First one is MEDPAC, National Association of Benefit and Insurance Professionals. Otherwise, it used to be known as NAHU, or National Association of Health Underwriters. They had a name change a couple of years ago. This is how Danielle and I met. The next one is NAFA. NAFA is National Association of Insurance and Financial Advisors. And then HAFA is starting to get more visibility, specifically in the U65 space, but now they're starting to get traction in the Medicare space, and that's Health Insurance Agents for America. So the first thing that I would tell you to do is get involved with one or multiple of those associations, because that's how you get your news. That's how you're able to connect and network with other agents across the country. They do it on a national basis. They do it on a local basis and on a statewide. They have a couple of national conferences each year. One of them specifically dedicated to legislative issues, and that is referred to as CapCon. Next year, it will be February 22nd to February 25th. And on that one, you have the ability of you go to Capitol Hill, you go and talk with your legislators. It is fundamentally, if there's multiple conferences we all know out there in the industry, this is one that, for your development, and if you are specifically wanting to learn more about how all of this works and actually be able to tell your clients that, hey, I was just on Capitol Hill in DC advocating on your behalf, this is the one that you want to go to. Do you want to share your experiences with Capcom? Because I know this is one that's near and dear to your heart.
Yeah, I hear a lot of times agents say, well, I don't know anything. I haven't heard anything. They haven't put anything out. Well, actually, if you're a member of one of these associations, I'm a member of two of them. I can tell you that I get emails multiple times a week, and there's always with NABIP, the Washington Insider, and there's lots of information in there about what's going on. So if you don't read those emails that you get, you're not going to understand what's happening. But a good way to address that would be to come to CapCon, and I can drop the registration link in when we open up the chat a little bit later so that you can register for CapCon. First of all, I will tell you, it's the most fun conference all year. It's the one conference I will not miss. In addition to great information and being able to go to Capitol Hill with people who know what they're doing, it's super fun in the evenings. There's a great bar there. Everyone hangs out and talks insurance until we drop, which we know that normal people don't do that. So it's like your one chance per year to get to do that. But the main thing is that I've met people at CapCon over the years that I am now friends with. And so we have texting groups when something new comes out. Amanda Chalin and I are always like, something drops and we're just tearing it apart on email and
Yeah.
text message. And then we go to the people that we know that will have the answers. Somebody here in the chat was asking about this HR 3467, which we'll talk about today. It's a no-go, a nothing burger, and those of us that are already involved in and have friends in high places in these associations, we already know this stuff, and you don't have to be anyone special to get involved. Like
Right.
just come to CapCon, start meeting people, connect with us on LinkedIn, Facebook, social media. Let us know that you are a member, and let's connect so that you can be in the same level of know that we are.
Right. So in into that, so a lot of the peer-to-peer discussions in the industry happen on LinkedIn. That it isn't That's not where you're going to grow your business. It's where you're going to grow your knowledge and your contacts of those within the industry. That's
Exactly.
also where Medicarians, the trade show, that is imperative because that allows you to actually meet those people that are that you've connected through and you've watched for sometimes years. Capcom is February 22nd to 25th in DC. You can go to the website, which actually, let me pull that up. I thought I had somebody in NABIP on there, but then I realized that, oh,
I have the
you
link. I
can't
can
go
drop
ahead
it
and
here.
do that. So if you go to nabip.org, and then once this goes ahead and it filters, you can go into the events. There's a link for annual conference. And then this one, unfortunately, has it has the 2025 information on it. But I know that there is a link for getting tickets for this year. So I will pull that and then route that back out on my pages. But this gets you the idea so that you can take a look at what this particular conference looks like, and how it is done. I am not going to route out my slides. You guys can take pictures as you want, or you can look at the replays on YouTube, that will be there. But I'm not sending the file because it's 3 megs and probably bigger than that, and I would rather not. The other place that I want to put on your radar is MedPAC. How many of you guys have heard that word or that acronym MedPAC? Any of you? MedPAC stands for Medicare Payment Advisory Commission. They meet a couple of times a year, and with that, they make recommendations to CMS and other government entities. Um, they had a meeting in March, and that meeting is made up of 17 commissioners. Most of them are, well, all of them are appointed by the GAO, and they are more on an academic side than they are on, other people within the industry like carrier reps or things like that. Um, so the topic of the March meeting was about what we do for a living and how we work with beneficiaries and what's the difference between the how you sell med subs versus advantage plans and what are the drivers and all of those things. And with that particular they publish these reports, and then these reports are picked up as a reference or a creditable source by the media, by CMS, by other legislators. So it's important that the information that MedPAC has is accurate, right? Well, one of the things that happened back in May is they started doing the investigation, if you will, or starting to learn about what is happening within our industry, specific to how we work, agents and brokers work with the beneficiaries. And there was a lot of conjecture. So what ended up happening is that I actually posted on LinkedIn and said there's misinformation here. Love a seat at the table in order to be able to correct that. And we ended up having a conversation with several, like I think there were six of them on the call
Mhm.
out of the 17 that had a discussion about where they flat out said, this is the first time that we're inquiring about how agents and brokers work. We need the information so that we have the ability of moving that forward. And we need the information to where NABIP and several other entities now have gone and had subsequent conversations with MedPAC. I know of several people that have flown to DC and met with them where they have shared their knowledge about what is happening within the industry to be able to formulate more of a concise or more accurate picture of how we interact with agents. And this is so important because, again, it goes back to working with the media and working with frame of reference when it comes to um, what CMS decides to do as far as regulation and legislators when they decide what they're looking at doing with acts and law, right? So that is one of the things that you've got. The issue that we have and why this is so important is that politicians have no idea of who we are. They don't know what we do, they don't know how we do it, and they don't know the value that we bring to our constituents. So, about 18 plus months ago, we ended up going ahead and we it, we attended CapCon. We listened to we had those meetings, and we collectively as NABIP came in and we're like, we're the good actors. We're not the bad actors. This is what we are. And we were almost met with this feeling of, sure you are, because you're not going to tell me that you're bad. You're not going to tell me that you're non-compliant, and there's nothing there. So fast forward about 6 months after that CapCon, and as the environment within the Medicare space changed, we ended up stepping back and looking at it and went, Michelle Malooly said, we need to bring back brokers making a difference. We need to get client surveys. We need to make this happen. And that's what started the ball rolling with us creating, NABIP creating a 5 question survey. Get your phones out, use that, and you should be able to scan the survey with that QR code. And please, please, please do that because that particular QR code, you can see how easy these questions are. And the only people that see the information are NABIP staff. So you don't have to worry about somebody stealing your information or having access to your clients or anything else. But this is a way for your client to give back to you. It's a way for you to say to them, you know what? If you found anything that I did helpful, your experience with us, the legislators, your congressman doesn't know what we do for a living and doesn't know how we help. If you can share your story about that, then we have the ability of going ahead and using that. And initially, when we rolled this out in September, people were like, you are full of it. There is no way that a dumb survey is going to do anything by moving a needle. And we had so many people that were like, I'm not getting involved with this. It's not, dumb survey is not going to do anything. And then we got 5,000, then we got 10,000. We now have 14,000 plus surveys that are out there. And there's surveys for Medicare, there's surveys for your ACA people. They are rolling this out so that there's multiple different surveys that are there. Now, what happens with that? Well, one now, come this past February, when we took another meeting with the House Ways and Means people, and when we met with the Senate Finance Committee people, guess what happened? We're sitting there in that meeting, and Danielle, you want to share because you were the one that led that meeting.
Well, the coolest thing is, when you're meeting with these legislators or any kind of meeting like that, you want to go in with something besides just your word. And so wouldn't it be great if we can blow this up to 25,000 surveys?
Mhm.
And when we're in that meeting and in many others, you can actually take handouts that NABUP has made with testimonials from constituents in your state. So beneficiaries that are in your state. And I don't know if you can, I think you can download those on the NABUP website, but I have the ones for Texas. And so you want to take real words from real beneficiaries, just like we did in that meeting and in many others, to say, hey, listen, yes, are there bad actors out there? Of course, but there's also really good actors. We are them. And here's 14,000 surveys to prove that brokers make a difference in the life of the client. And I will tell you, something I learned a long time ago is that people like to help people that have helped them. Someone asked me recently, how do you have 11,000 five-star reviews? The answer is because we ask for them. Simple, easy. So I took the survey link, put it in my Facebook group, and said, if we made a difference in your Medicare decision, would you please fill out this 5-question survey? Scores of people, yep, done, 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 done. So your clients will not feel put upon to do a survey like this. If you've done a good job for them, they want to help. So please give them that opportunity, because they don't like to be enrolling in drug plans where you're not their agent or representative, right? They want you. And in that regard, they want for you to get paid so they continue to access your services. And this is how we get traction with legislators.
Yeah. So, and this is, I just pulled up the sample. So if you go to nabip.org, there is a section that has the uh, each state on it, and you have the ability of printing these out when you meet with legislators or anything else. It shows here's what it is, here's what the stories are directly from the constituents that live in Texas.
Yeah,
And
so
then there's
powerful.
another one that shows what the experience is when it comes to what the agent is. So you guys are not seeing this. Hold on a minute.
Question here about the surveys. You're not going to
Yeah,
get the surveys back from your clients because they're not listing an agent when they submit those.
right.
They're just going into the collective, and then NABIP is pulling out testimonials and putting them on
Yes.
different state sheets for you to use.
So here is the sample of what the survey looks like. I put the link in the chat. I will put it again in the link in the chat so that that way you have the link to this particular survey. But these particular items or these handouts are done for every state. And it's one of the many things that we have gone ahead and used when we are working with legislators to go ahead and help them with that. And what ends up happening is that, when we start talking, we say, you know what, here's what makes us different. We have a code of ethics that we abide by. We are all, it's more about making sure that the client is taken care of above everything else. And oh, by the way, we have 14,000 surveys collected of beneficiaries sharing the good that we do in the community. And when any staffer, legislator, anybody that we're talking to has that, like the immediate response is, well, tell me more. What are they saying? And
Yeah.
that's why these surveys, you may look at it and go, well, my one little survey doesn't matter. Well, there's almost 1 million life insurance and health insurance agents out there. Imagine if we had one client for each one of those agents that went ahead and said the good that they did in their community, helping them with a problem.
Yeah.
imagine the heads that we could turn at that point because of that. So it's super important. That is one of the ways that you can go ahead and you can help. But
And let me
go ahead.
add, Amanda, if you're not a member of NABIP, you can still do this with your clients. You can
Yep,
create
it's
a
open to
survey
everybody.
on
Yes.
SurveyMonkey, and send it out and have your own testimonials about you that you take to your local congressman in August when they're home. There's many ways that you can do this. And Amanda was just saying, these are something that you can use even if you're not a member of the association. So it's important that if you plan to speak with a legislator and you're going in, you want to have always some constituent example from somebody that lives in their district.
Yes. And so, how are we using these surveys? What have been done with them? There's several things. So, one of the things that was done is that back in March there was a joint letter that was sent to Congress and the leaders of Congress by five of our industry organizations, going and talking about what's happening. Nicole's question, 14,000 surveys collected thus far across Medicare and what other sectors? About 90% of that is Medicare. So that's primarily where it is. They've just rolled out the ones for ACA. The other things, as we said, they're used with CMS officials, and other HHS officials to discuss what we need and the feedback that we have. The goal is kick the door open with having those surveys and to pull a
That's
chair up
right.
at the table and say, hey, you know what? We need to have a conversation. And here's why, because we advocate on behalf of the beneficiary. And this is where they're at. The surveys are open. It is not ending, so you'll continue to be able to submit those until the cows come home. So we'll take all the help that we can get when it actually comes to that. Sarah, hold on a minute. I've got to post the link to the letters.
Yeah.
I'm just reposting that now. Um, so you can do that. The other thing is that we're trying to get a new survey that is done for the uh a new study. So Commonwealth did a study back in 2022. And it basically has been cited all over the place. And the problem with that study is that they took the experience of 29 agents. That's it, just 29. And that has become the source of truth when it comes to what we do. And it's
Yeah.
affecting regulation, which is a problem. So, one of the things that we want to make happen is we want to get a new survey commissioned or a new study commissioned so that way we have the ability of getting a more accurate picture. Guys, the reality is that study is going to cost over $125,000. Because of how expensive that is, we need to raise the money to be able to help have that happen. We also need to raise money to go ahead and bring awareness to what we do and what the value of working with a broker is. There's many other things that we need to bring awareness to, and that takes money. So the NABIT Foundation is a 501(c) foundation. Anyone, whether it's a vendor, whether it's a carrier, whether it's a person, it's tax deductible. Please go ahead and donate. I know NAFA and HAFA also have organizations, but this allows us to go ahead and help protect what we need to and our industry as well as ourselves, right? So, you know what? You don't want to do surveys? Send me money. Send us money. That helps. If you don't want to do that and you want to be a little bit more advantageous, um, and you can get a meeting with your local legislator, do that and then reach out. I know that I actually had a conversation with Rick Israel yesterday for about an hour and a half. He's meeting with one of his legislators. I know that he's talked with you. I know that he's reached out with a couple of other people, but that's how it's done. Go ahead, reach out, schedule the meeting. Hopefully, it's a couple of weeks out so that you can prepare. And then there are plenty of us that will grab your hand and help you through the talking points and how to have an effective conversation with that legislator to help us move the needle forward when we're looking at that.
Absolutely.
So those are a couple of ways that you can help. I know Danielle also has some other suggestions.
Yeah, it's interesting about the what happened with Rick is, he reached out to me saying the network issue. We've some of you are aware that there's kind of like ghost networks with some of the carriers where it may say that there's a specialist in a certain field, but then that specialist is only accessible for people with certain types of conditions, so it's not actually working. This is something that is so important for them to bring to that attention. So you can get involved by reaching out to any of us. You can meet with your own legislators. You can donate to the foundation. You can donate to the PAC. And if you don't have any of those things, I don't think that's an excuse because you can give your time.
Mhm.
So, when I started my agency and I first joined NABIP, I think the whatever the membership fee was back then, $40 or something a month. That was a lot of money to me back then. I'm trying to grow my business. But I got involved right away. I went to the local meeting. I volunteered at the first meeting. Are there any open board positions? And I joined the board before I knew anyone. And for years, I gave my time to
Mhm.
the association on every level that I could until I reached a point where now, of course, I can give money and get involved at a national level. But it's all as far as you want to take it, right? I mean, Rick could have just said, oh, poor client can't access their network, nothing we can do about that. No, he reached out to me, he reached out to Amanda. He wanted to learn how to meet with the legislator. We've given him the talking points, and kudos to him that he just ran with this. This is what we should all be doing every single time. I watched the Medicare advisory hearing the other day, and at the end of it, this is you can always find the recordings of these, but when they were having this congressional hearing at the end, I'm firing off emails to people on the panel and also to the witnesses that were there, the ones that we know,
Mhm.
giving them my input, thanking them, just to establish a relationship. So
Yeah.
um, there's a lot of things that you can do depending on what mode that you want to give.
Yeah. Well, I mean, Don Maroney and Sachin Jain, both of them,
Yeah,
I had conversations with them via LinkedIn Messenger before I actually met them in person. So it was super cool when they testified for the Ways and Means this week to be able to message both of them and go, caught your testimony, super cool, great job. And, they were super excited to be able to do that. That's quite a kind of accomplishment to be able to
yeah,
say, to testify like that. And it's just you have to foster those relationships, and never in a million years did I think that I would be doing advocacy work, but here I am and I love it, and that has been
so
super
much fun.
super cool with that. So flipping into the next question that we got, and that was what's the future regarding the agent and AI? There's some stats that I wanted to level set with you guys. I am a stat girl. Anywhere that I can, if I can get statistics about what this industry looks like and a snapshot, then I want those because I quote those back to the media. I quote them back to legislators and anybody that I'm educating. But you have 68.5 million Medicare eligibles as of July of at the beginning of this month. The one thing that I do want to call out is that as of the most recent report for which is in 23, there are only 12,500 trained ships people. And those are the volunteers that are employed by the various states to go out and offer nonpartisan help and education within those states. There's only 12,500 of them. That is not a lot of people to be able to help everybody. Not, with over 68 million people there, right?
That's right.
Most people,
They focus on people that fall through the cracks and
right?
they don't have time to deal with people above that station. That's where we come in. And
Yes.
so we have to be willing and able to recognize what they do good at and what they don't do good at, and then come in and fill that need.
Yeah. And, Lori just said that's such a small number. That's why I wanted to put that out
Yeah,
there. There has been in the media talk about, oh, well, MedPAC said that, it should all go to the ships people. Do you really think that 12,000 plus people can handle 68 million? The answer is no. So let's put this into perspective when you are watching things that are happening in the media and how those things are. Mary, as I mentioned, it is that they are volunteers that the state works with to disseminate Medicare information to the
They're like
US
navigators.
population in that given state.
Yeah.
They are not agents, they're volunteers. They take a couple of hours of training, but that's basically what they are. The other thing is that there isn't anywhere that actually specifically tracks the number of Medicare agents that are out in the country. So this is why being involved in a professional organization is such a big deal. Because the professional organization, you have the ability of saying, hey, I sell Medicare, I sell ACA, I do only group products. But we have the ability of going and then tracking and getting a ballpark of what those are. So that's one of the other things that you want to go ahead and note. The other thing is that most people want to work with, they can do their research all day long online, but they actually want to talk to somebody to talk about their insurance needs. And I know, Danielle, you have AI throughout your organization. Can you talk a little bit more about how you see AI
Yeah.
and where that's going?
Yes. So we had a question that came in about like, what is the future of AI and is this going to replace agents or are humans not going to be necessary? And I wanted to just challenge you to think about what is the future of agents plus AI? So, just kind of walking through some of my thoughts on this because we are already using AI in our business. Anyone can sign up for a Chat GPT account. There's a business account. And I have gone in there and I asked the AI, what can I tell you about myself so that you will learn me, my speaking style, my writing style, and be able to give me content based on me? And the AI gave me a bunch of questions. So I went through and put all that information into the AI, and now I can use it for creating something in a couple of minutes. Just last week, I said, uh, act like you are Danielle Kunkel Roberts. Please review all my YouTube videos and give me 5 top ideas for things that I haven't covered. And I hit the button and I had 5 ideas in like 5 seconds. And a couple of them were jaw droppers, like so good. I couldn't wait to write the video script. And then I said, well, you know what? I could probably get help with this. Thank you. Could you please write a script in my voice? And so that I can film this. And in another 5 seconds, I have scripts for all 5 of those ideas. And then, of course, I go in and I edit them and I add some things that I think are useful. But this is how you are going to use AI to become a better agent. So in your business, you're going to use AI for efficiency, automation, research, and even client notes. AI is really great for automating the repetitive tasks. It's going to help you recommend plans based on usage or simulate coverage scenarios. So you want to think about as AI as supercharging what human agents are able to deliver. Consider that it's going to free up time for you for higher value work, like advising your clients, relationship building, very nuanced cases, things like that. You can automate client follow-ups, reminders, and basic Q&A. You can use it in marketing. I've given some examples already, but you could have it write your blog posts, your newsletters, once you train it in your voice. Now, do you know how long it used to take me to do a blog post? I was writing blogs way, way early. And it would take me a couple of hours to put my thoughts together. And now I can tell it to write like me and have something in 5 seconds. And then I'm going to go in and do a little editing so that it sounds, like it really did come from me. You can use it to chop up your content. Maybe you're putting YouTube videos out there and you could say, review my videos and give me some short reels. You could set up a basic Q&A. You can do a chat bot to answer basic questions on your website. I use it in the human resources function. I have used it now to revamp and rewrite all the job descriptions in my business. We use it to generate Instagram ads, Facebook ads with ideas. So keep in mind that this is about like workflows, job descriptions, sales sequences, but AI cannot make human complex decisions that involve emotions like fear or trust. AI cannot act as a fiduciary, which is exactly what all of you and we are, right? We act in the best interest. So when we're helping clients across multiple systems, Medicaid, LIS, Medicare, ACA, uh, this is not something that AI can coordinate effectively and understand the depth of what we do. So I don't feel like you need to fear that this is going to stand in the way or take your job. What you should do is embrace it and learn it. Go to udemy.com and take a couple of basic AI classes. They're super cheap and you can learn some great things there. We have, see some requests here for us to put out more information. We're happy to do that. We can do future webinars about this. But a couple more points I wanted to make is that retention and referrals, those types of things, they are rooted in human connection with your clients. And that is something that AI is not going to do for you. It's not going to build up brand loyalty and long-term relationships. So I don't think it will replace a strong, trusted brand. And that's what you need to become in your market, a strong, trusted brand that uses AI to do the easy tasks, the repetitive tasks, the things that eat up a lot of your time so that you can focus on the things that totally drive that. I'll drop in the chat here the website that I go to all the time for basically any type of course I ever want. It's called Udemy, and I use it for that. So these are just some general ideas about how AI can really supercharge your business. And I don't want you to be worried that it's going to replace us. I don't see that happening.
Awesome. Okay, so we did go ahead and get the actual link for CapCon. I did post that. Thank you, Jameson, for pulling it. So you can check out and register for CapCon through there. We expect to have a minimum of 850 agents and officials and legislators there. They even have a cocktail reception where they bring staffers and legislators in. So highly suggest that you take a look at that. Um, Udemy is awesome for coursework, so I totally agree as far as
Just
looking
getting
for
your
that.
feet wet and learning.
Yes.
There's courses on everything you could possibly imagine.
Yes. Do you use any other tool outside of ChatGPT for AI, or is that primarily what you use?
On my mobile phone, I use Grok, which is a different AI that's Elon Musk. It's that company's tool.
Okay.
And sometimes I like to put questions in both just to see the difference in
What
what
the
comes
difference
back.
is? Yeah.
Yeah, I feel like ChatGPT is a lot more business driven,
Okay.
and Grok is something I use for a lot of quick, easy questions in my normal life. But there's others that are great. And in fact, in some of those courses that they have online, it will show you like 5 or 10 different tools. And there's AI for video, there's AI for making your pictures look better. And then these are all different. And if you take a course like that, you can kind of find out which ones seem like they'll be really helpful to you, and then just sign up for the ones that make sense for what you do.
Awesome. And I'm answering the questions as
Correct.
they're flying through. So that way you guys have them. Yes, you do have some Copilot stuff that's there, as options. There's all sorts of different AI features, like Zoom has note-taking features, Firefly has note-taking features. I know that that's something that a lot of people are looking for or
Yeah.
interested in. So yeah, there's several of those that are out there. Um, Jennifer Kaufman says Capcom literally changed my life. So I highly suggest that you come. And I agree. It did change my life as well. So that is definitely something that you want to go ahead
Yeah.
and
And it is so
and
much
do.
fun to go every year and see all the same people. And it's like your insurance family getting together. I love it so
Yes.
much.
Yes. Okay, so next one. When we go ahead and we look at the next question was is about prior authorizations being the norm. This is due to a bunch of news media articles that were routed out, and those are when we look at how this came to be, CMS does what's called a demonstration program. Anytime that they want to go ahead and test things out. So when you are looking at it, currently there are five initiatives that are currently being worked on when it comes to prior authorizations. The first one that's hitting the news right now is called WISER, and it stands for Wasteful and Inappropriate Service Reduction. And it is a 6-year demonstration program that they're using. It's primarily regarding prior authorization on traditional Medicare, which is not really done before. And it's to look at outpatient services um, that are like epidural steroids, cervical fusions, arthroscopic procedures. Those are primarily the ones that are being affected, but it is only in 6 states. And that's the thing that I want you guys to hear is
It's a
that it's
pilot
only in 6 states
until
that this is
2031.
applying for.
So like until 2031, that is how long it will run in those 6 states. So we're
Yes.
not going to see any massive prior authorizations overnight nationally.
Yeah. Okay, so other things, let's talk about the big beautiful bill because this one is always a fun one that everybody's freaking out about. I also know that so I'm going to go back. Carol's question, will Wiser affect Medicare supplement plans in Ohio?
Yes.
Well, Medicare supplement works with traditional Medicare. Traditional Medicare is affected in Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. So that answer is an emphatic yes. So, the states are out, and I just called them out. So either clean
I
your
can drop them
ears,
in.
or
Yep, I'll drop them
you
in.
were asking as I was answering. So other things, when we're flipping back into the big beautiful bill with this, there's been a lot of media to it. There have been right now what I see in social media is a lot of people that are doing a who's on first, let me get it out there first, and and it's not necessarily accurate. I've corrected quite a few people with their posts because they have had incorrect information. So here's some high level stuff, and this is only specific to Medicare beneficiaries. There is way more that is in the big beautiful bill that affects under 65 or other things. We are only specifically talking about the ramifications to Medicare beneficiaries in this webinar. And the one thing that I do want to call out, there's 5 key ones that we're going to look at. The first is the eligibility. And, as you can see, it is limiting the Medicare enrollment to US citizens, permanent residents. And it is up to Social Security to figure out who no longer applies and kick them out by January 27. So this isn't something that they're going to be gone within a month. It is a reaction time, there is some reaction time to it, but it is something that you need to be aware of, especially if you are working with populations that, immigrant populations that are out there. The other thing that we want to note is that the funding when it comes to provider access and reimbursements are basically being frozen. So that's the next piece that you have on this particular screen. You want to take the next two or the
Sure.
next three?
Yep. So the next one is improvements. Some of the improvements are suspended. So you may have lower income seniors that lose some support. We saw that in the Kaiser Family Foundation. They are projecting about 1.3 million dual eligible beneficiaries could potentially lose benefits. And the loss of this coverage it has to do with that delayed implementation. So, one of the things I want to point out there is as this is happening, your role is to inform, right? When you have clients that are potentially affected, you're going to be working with them to find what other solutions there are and letting them know how it will affect them. And that doesn't necessarily mean that we're suddenly going to see everybody that we have that's a dual eligible, like Amanda said, losing things overnight, but we do want to know that it potentially could happen and we need to be ready to help. On the drug costs, there's a cap that has removed on negotiating drug prices for those orphan drugs. So these are rare disease medications. And then lastly, quality of care. So staffing standards for nursing homes, these are now being delayed until 2035. And the courts found CMS staffing rules exceeded statutory authority and arguing agency action can't override Congress's existing 8 hour R and the floor. So some of these are kind of like getting into the weeds a little bit, and they may not things that you totally run into all the time, but you need to be aware of them when you have clients in those situations and seeing what the timeline is.
So I want to specifically call out the blast bullet point about the courts. When we go ahead and we look at the power of CMS is being challenged in federal courts. And that is something that you all need to know. That is due to a Supreme Court case that was won last year. And yeah, it was last year. That basically challenges the authority and the source of truth when it comes to the government entities like CMS. So the other federal court case that everybody knows about, of course, is the one in Texas, 5th District, concerning the final ruling for 25 and the compensation. And part of that court case was also about citing that CMS does not have the authority to
Yes.
go over congressional. And so this is another one where the court sided with the entity being the nursing and the nursing homes saying, whoa, 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 you don't have this authority. That takes an act of Congress. You don't get to do this. And the courts, or, the nursing home won. So you're seeing a lot of that, or a lot more of that as we're going through. Um, so on the orphan drugs, so the orphan drugs on Part D will have no limit in cost. Correct. So what's happening is that for the negotiated drugs, and here's the thing, guys, the 26 negotiated drugs, it's not a list that has hundreds or thousands of medications on it. It's a handful of medications. So and it's only those handful that, and the subset within the handful that are on the rare disease side that are not being capped. So it's a subset of a subset of a subset. Be careful with how you're going on that. Um, in regard to more in-depth discussion on the Big Beautiful Bill, in its entirety, there is a Big Beautiful Bill. There was a webinar that HAFA did yesterday for a couple of hours. There's another one that NABIP is doing over the next couple, so that way, in regard to group, I'm sure that there will be more training that is going on. Specific to Medicare, there aren't a whole lot of things yet because a lot of this isn't going into effect right this second. Um, Stay tuned for more information before you go down that rabbit hole because these are things that some of this that it can wait. The biggest impact that I see is that they are slowing down the processing when it comes to the low income subsidy and the Medicare savings plan. The processing and the verification of that is going to get slower, and that is upsetting because that will actually hurt some people, a lot of people.
Hmm.
So let's talk about the HR 3476 that is all over the media right now.
We've had a lot of questions on this one, a lot.
This one, I was in a Facebook group this morning and I saw somebody posted the article, and there's all of these comments and panic and dumb stuff. And I'm looking at it, and guys, this is what media does.
Mm.
That is the whole point of what reporters do. They want you to go ahead and have a reaction. They want to report on things even as minute as possible as they can, just to freak you out and to freak out the seniors. The likelihood, you see at the bottom where it says the likelihood of this passing is 1%.
Yeah, I think I read it couldn't even get a co-sponsor. Like there were no
No,
co-sponsors for it.
it is
So,
absolutely awful. So these people that are freaking out about a 3-year lock-in in their plan or auto-enrolling into Medicare, tell them flat out, it is absolutely awful and it's not going to get any traction. So yeah, I have a typo in there. It's 3467. Good shot. Good call out. So, um,
also,
gotta zing me, don't ya?
oh, dang it, I hate
But
it when it happens.
yeah,
Um, Keep in
oh
mind that politicians file all types of bills for publicity reasons so that they can go on television or social media to say, today I have filed a bill to stop blah, 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 or to enhance blah, blah, blah. And how many times a year do you see Congress actually passing bills?
yeah,
So a lot
it's
of these things you see get filed are simply for the way they look in front of their constituents, like they're doing something. But a lot of times there's not any legs to this stuff.
yeah.
We call
It's
it a
a
big nothing
lot
burger.
it is a lot of there's at least 20 different bills that are being talked about or on the table at any given point in time. And you can watch them as they progress. There's some of us that do. Before they even hit the media, the insiders, if you will, that geek out on this stuff, we've been watching it since
Mhm.
the time that it was developed all the way to as it gets traction. And this is where one of those things, and I'm going to be kind of obnoxious about it, which some of you are going to be like, okay, and this is not unusual for you, but watch what NABIP does and what they're talking about. Watch what Danielle, Chalin, me, Jameson, Sam Melamed. There's several of us that are out there that if you look at what we are following, we will be able to go ahead and share with you, yes, this is a real threat, or no, dismiss it, it's stupid. And that's the thing is that you really want to go ahead and do that. So, yes, Dr. Oz went ahead and talked about it when he did his hearing. And for the 2 seconds that he talked about Med Advantage and ideas on how to solve the massive problems within the Medicare structure, that was one of the items that was on the table. That's all it was. It was a discussion about what was on the table. So just because somebody tosses it out does not mean that it becomes reality. And there are multiple steps that have to happen as things progress once the bill is introduced. And that's all it was. It was just introduced. It will not pick up speed when we're going ahead and we're looking at it. So just some food for thought when we're looking at what the media is talking about and the mess that is being there. Um, Other things to note is that, and Carla brings up a good point. If someone is scared about this bill, tell them to fill out the survey to protect the ability for the agent to go ahead and help them and work with, and protect them. So that is a very valid point when you are looking at combating these things. Um, just to reiterate again, I am recording this. It will be out on my YouTube channel. I've had several people that are asking that again because you're late, and that's okay. Yes, you can. So, what is happening for 2026? Let's get into the meat of that and how this is like, let's get into the changes. Let's talk about where that is. So, I have had 4 different people over the last 3 days tell me about the opportunity in Medicare is going away. And I took everything in me not to laugh in their face. Guys, the opportunity is growing, it is not shrinking. And I don't know how more clear I can make that for you. Just because you think that certain things are happening, like the changes with the availability of plans on the quoting tools and commissionability and AI and all of that, that does not mean that there isn't other opportunity in other ways en masse. So when we look at this, I want you to look at these stats that are right here. So you've got the Med Advantage penetration of that 68.5 plus million people. 54% of them are on Advantage plans, and that is only going to increase approximately by 2,000 every year for the next 10 years. 10 years, pushing that up to over 64%. When we look at that same 10-year period, so from now until 2035, you have 20% of the market is going to go towards supplements. And these are things that allow you to have lots of opportunity. So stop freaking out. Love you. Stop it. Get out of your head, because I get that it gets scary, and we're going to talk about the commissions in a minute, but there's more opportunity here than any of you could possibly capture. And that's what I want you to hear with both of us doing this is that there's so much opportunity here, not enough people to handle it. The trick is you just got to figure out how you're going to do that. And we're going to talk about that also in this call. So let's talk about the trends with the birthday rules and the GI rules and what's going on with all of that, because Medicare supplements are done on are done through the state level. They are not a federally level. It's not overseen by the federal level. It's done by state. So when we look at that, we've had a lot of changes when it comes to that and birthday rules over the last couple of years. Some of this isn't so good, guys. So Danielle, you want to take this piece?
Yeah. So the reason this is gaining traction is because consumers want to remove barriers to access the plans, and legislators, they really have not done a deep enough dive to realize, I think, what is happening with the insurance premiums on the back end. I actually was just chatting with a senior VP at a very well-known Medigap carrier last week about they're lobbying too, trying to get people to see what's actually going to happen. So these states with the birthday rules, they're trying to address the churn that they see, but we know that this negatively impacts rates. I saw statistics online that it was impacting the rates in those states anywhere from 9 to 15%. But I know that we saw some much bigger increases than that this last year. And one of the actuaries that I asked at the same Medigap company, she said that they typically see within a couple of years of a birthday rule that the rates will go up about 30%. So we're talking about this. I just put a YouTube video out about this to let people know. And now I'm saying to folks when they're coming in or they watch our webinar, if you want to go with a Medigap plan, here's what you need to understand. It's not going to be just what the cost is today, but if this plan were to go up 15 to 20% every year, how long could you afford it? And that's one of those questions that we should be asking upfront to our clients and determining whether it makes sense for them long term to do a Medigap. Because what's going to happen is those of us that write a lot of Medigap, and my team is right up there in it, we have seen where even after we explain to them all the reasons why they should do a Medigap plan and we get them all signed up, sometimes a few months later, some agent comes along and tells them about a zero premium MA plan with a free grocery card, and they're just going to flip over to that. And that's just what's happening. All of the headwinds facing the Part D market, this is likely also to affect Medigap. So some of the things that I think you may end up seeing, we talked about this, very interesting. I don't know if you guys saw this, but in Maryland, their birthday rule that just got put out states that the carriers must pay us agents full commission even on GI plans. So very interesting trend. I'd actually love to talk with some of the insurance commissioners in Maryland and kind of get the feedback on, how they came to that conclusion. So potentially what could they do? Well, it might be that suddenly they have to lower the commissions a bit on all of the business to make up for what they're now being required to take on birthday rule or GI business. But now you're getting paid on the GI business. So in the net, is it really a loss? We don't really know yet. So I want to keep an eye on what we're seeing in the rules that the states are that these are creating. So recently added birthday rules were, oh, Amanda's got them on the slide here. So we have Kentucky, Maryland, Nevada, Oklahoma, California, Oregon. Some of these were already in there. We have new ones, Virginia and Utah, Wyoming. And then there's pending legislation in a whole bunch of other states. So I think we can see that this is actually going to become the norm in a lot of states. So we can expect this to continue. But if it drives up the premiums, we need to be that voice in DC and with our local legislators saying, hey, we know you made these rules in the best of intention, but here's what's actually happening, right? This is what's actually happening is we have more and more people being driven into Medicare Advantage because now they can't afford the rates, which maybe wasn't the intention, but they're making these high level changes and somehow they're not actually talking to the insurance carriers to see what is going to happen on the back end. So our voices need to be loud about that, bringing that up to them and showing them the clients that we have that would rather do Medigap, they're having to change to MA because they can no longer afford it.
Right. Here's the other changes in regard to year-round GI changes. So for those of you that need that information as to if you're selling in other states, um, there are, so I had somebody go ahead and comment and say, well, this is all well and good that there's opportunity that's out there, but if we're not getting paid, then there's no opportunity. Tough love point on that. There's opportunity everywhere, whether you're getting paid or not, because whether you're able to help somebody and write an application or you guide somebody and that person goes ahead and recommends 40 different people to you to go ahead and write them, there's opportunity. What ends up happening that you help somebody that was non-commissionable and then you turn around and they said thanks because they weren't getting paid on that, but instead magically they have an annuity that you write that you end up making $10,000 on. Get out of your head and stop thinking short term and short sighted. I don't know how many more times I can tell you guys that. Don't look at it as a short term play, look at it for the long haul because Medicare is a business that is referral based. You win by doing referrals. You win by going ahead and giving good service. And then they go back while they're sitting over coffee and saying, hey, you know what? You have a question on your Medicare? Go talk to Danielle because you know what? She took the time and she answered all of my questions. She didn't even have to. And because of that, then you get additional business. The fact that some of you don't look at it in that respect, and it's, well, what's in it for me this right now in this 2 seconds? That is why you have a problem, and that is why you are not growing. So stop
And
it.
and on the flip side of that, while you're not panicking, you can also take action, right? So Debbie sent a message here about that she knows some of the NABIP organization was actively lobbying in Maryland to make sure that that clause for commissions got into the rule. Okay, we need to be doing that nationwide. So at the same time that you're shoring up things in your business and cross-selling and doing the ways that you should be doing to survive, you can also fight back by arming your legislators with information about how this is negatively impacting and advocating for how do 67 million people get help with their Medicare every year if brokers can't afford to live, right? So you can attack this on two fronts. I know that California, NABIP is all about this.
Mhm.
So they would be a great chapter to model after, but you can't complain about things when you're not actively taking steps to fix them.
Yeah.
And we're showing you some ways today that you can get involved in doing that.
Well, and one of the other things is that I have quite a few people that I'm watching going, okay, but my E&O doesn't cover it. Then go get new E&O. Don't buy the cheap E&O that doesn't cover you for all the things. That's going to vary by carrier of your E&O and by your state. So have the question with the people that you are going ahead and that you have your E&O with to figure out what is covered and what isn't. Those are different ways that you can go ahead and get to solve this. These are hurdles, they are not roadblocks. You have to look at how you change how you are looking at the problem. That is what we all need you to do. How you did business 10 years ago, 5 years ago, a year ago, they're changing. If you do not shift how you are changing and doing your business, you will get left in the dust. And for some of you that throw your hands up and go, you know what, I don't need it. I want to sell my business and I want to get out. Well, guess what? There's plenty of us out there that will buy businesses. So all you got to do is get your ducks in a row and then you're able to go ahead and make that happen. So,
I have a
um,
controversial opinion to serve up.
yeah, go ahead.
I want to also say we're concerned about our E&O if we write non-commissionable products. The option would be stop writing non-commissionable products.
Right.
Stop training carriers that you will fall on your sword for seniors and do the business anyway when they don't pay you.
Mhm.
There was a carrier last year, we all know who it is, decided not to pay renewals. 150 agents at Boomer Benefits did not get license renewals. Only the two owners did our license renewals just to keep our Medicare Advantage on the back end. And we will not be writing that if there's not a contract change, even if they come out and sell later on the back end that is not a product we would pick up unless we know in the future we can negotiate that we'll have renewals. But you know what we didn't do? We didn't go out and write that product. I didn't give my pearl so that people could enroll. And then I'm the agent of record and I have to do the back end service on a product that I didn't get paid for. So, how do you do this while also helping your clients? There's a lot of good ways to do this. There are several great agencies out there that are no longer actively writing Part D, and they have built other things in ways that they help their clients. So, this is something that we are considering in my agency for next year. We're waiting on some numbers to come out, and then we'll make a decision about whether we do Part D at all. But that doesn't mean that I can't help my clients in many ways. First of all, I can run a webinar once a day, 3 times a week during AEP. People come and I'm going to live show you how to look up a medications. And I'm going to take a sample list and I'm going to walk you through exactly how to use Medicare.gov to find the right drug plan. And I can stay on that webinar as long as I want with the questions that people are asking me visible only to me so they can feel comfortable to ask a question about certain medications if they want to. And then I can also film a video that explains to them why we're no longer actually writing the business, but we're going to walk you through this every year. Example of this would be Joanne Giardini and Cameron and their business, Giardini Medicare, great business, great agency. They stopped writing Part D a couple of years ago and didn't really see any fallout at all because they're letting the clients know up front, yes, we do help with Part D and this is the help we offer. We're going to actually train you how to do this up front. And then every year we give you support on the back end when you have questions about running your own drug list. So I'm just throwing an option out there for you instead of complaining about, well, I'm non-commissionable and I have to help my client. There's more than one way to help your client, and you get to choose how far that you want to go with that.
Yes. So let's start getting into the Part D side because that's actually, this is part of it. We are going to go on the med sup side or the Med Advantage side of this also. So we know for a fact that at least 2 carriers have filed for Part D plans and that will pay agents. Those are Cigna and Humana. We know that hands down that they will be paying. So the whole, oh, are all commissions going away? No, they're not. And at the end of the day, you do want to go ahead and do what is in the best interest of your client. At the end of the day, whatever that is. And if that, it just is. Other changes that you want to go ahead and um take a look at is that your out of pocket is going to go to 2100. You also have your deductible that is going to go to 615. You've also got it where the payment prescription plan, if they were enrolled in that now, it will auto renew. So they don't have to worry about going back and re-enrolling. There have been some changes regarding the creditable coverage, and I do want to spend some time talking about that, and that's the bottom of this. I would highly recommend that you take screenshots of this so that way you have the information. So the changes in regard to creditable coverage rule. The first one is that what deems somebody or a group plan as being creditable coverage is that it is going to go ahead and have both brand and generic drugs covered. It is going to have a broad formulary. They will have access to mail order and retail. And then there's an actuarial value test, which this is the key one, guys, because this was something that was put on hold last year. So fundamentally, this is what I need you to hear. As of 2026, the plan must cover at least 72% of the average expected prescription drug costs. This is up from 60%, and I'm going to go into detail in a second. So sit back and wait a minute. So this is going up to 72%. And I just said sit back and watch, and I've got questions that are already jumping the gun. You guys can't listen for shit.
I like
Good
that they're so
God.
engaged, though. That's great.
So when you go ahead and you look at this, so how do they deem that the coverage is credible? What you're going to do is they have to, and the employer must annually determine whether the drug coverage is credible. And there's two ways to do it. They're either going to go through the actuarial equivalent method, or they're going to use the simplified safe harbor method, which is good for those that are small to mid-size employers. Now, when you go ahead and you look at that, what does that actually mean? So the next slide is actually going to not show you the information that I thought it was going to. So what it's going to go ahead and do is that with the simplified method, there's tweaks in regard to that as to how they can go ahead and deem whether or not that they fit into that bucket. In the event that the carrier is not creditable or not, they have to notify the Medicare eligibles and their dependents by October 15th or on eligibility. They have to report it to CMS online within 60 days of the plan year, and in the event that they don't, the employee runs the risk of the late penalty. So you do want to note that these are fundamental shifts for this upcoming year. Again, going back to that, you have it where the plan must cover at least 72% of the average expected prescription drug cost. So those are key things to note when we look at that. Now going into Med Advantage stuff. So some of this is based on the final rule from last year, specific into the VBID model, and that they are terminating the tailored supplemental benefits. So the robotic dogs are no longer available or will no longer be available as of January. The cell phone coverage is no longer going to be available, all of that. Um, and it's due to excessive costs. However, there are some shifts. Um, Kelly, yes, it is a 2100 on the group plan. That is correct. It's the same as the standard format of the Part D. That is the cap. So when we're looking at this, what is happening, you have to take a look at the changes. I know a lot of you were asking questions because you're specific to Ohio, about DSNP changes in Ohio, MyCare Ohio. That will be a different training that I do later. Just haven't had an opportunity to go ahead and take a look at it. So, um, robotic dogs. Yes, there are plans out there that cover robotic dogs for lonely seniors. And yes, I laughed at that too. So, um, yeah. So here's some things that you've got, when it comes to Advantage plans and planning for this AEP, you need to expect that there's service area reductions that are going to be coming.
Yep.
There's going to be fewer options on PPOs. When we look at the what happened with the commissions, which I'm skipping as to the PPO options being available. We're going to talk about the commissions in the next couple of slides because that's the other piece of this. But everything restarts on the calendar year, right? So the mid change that we had with these commissions, that's going to roll into all of these changes for 2026. They're going to look at what's going on. And the number one thing that is affecting these products and the carriers is the changes due to the Inflation Reduction Act.
Yeah.
The cover, that $2,000 cap is significantly an issue. You also have it where the formularies, you had $14.1 billion covered regarding Manjaro, Ozempic, and the semaglutides. Of course, that's going to have an effect on plans in general, Part D and Advantage plans, and how the claims are covered, right? So these are things that coming into 2026, you best believe that the carriers are going to adjust things to accommodate for those kinds of costs. Do you have anything to add on this slide before we move?
Yeah, just keeping in mind that the reason they terminate commissions is just an easy way for them to not get new clients into business plans that they're probably going to terminate. And it's not fair, and we should have more notice, and we can fight for that. And of course we will. But this would also be business that had you enrolled them into that plan, then now you're going to have to switch them anyway because they're going to have a plan exit. I would recommend that if you're doing Medicare Advantage plans, you need to find the good HMOs in your markets because we can expect to see fewer and fewer PPOs, in my opinion. And this is not a huge issue because the vast majority of people on Medicare Advantage plans are in HMO products. And this is what you will probably be selling the most of going forward.
So, are we dead men walking? Will the brokers be phased out? What will the commissions end? Has NABIP made any progress on regulating and combating commissions changes during AEP? Guys, there is a lot of stuff that happens behind the scenes that you guys don't see on a daily basis when it comes to people volunteering to advocate to protect our industry. NABIP has people that are on Capitol Hill. They're there, they're in DC, they're on Capitol Hill daily. They are talking with legislators almost daily. We have lobbying organizations that we hire to go ahead and advocate on our behalf. All of the other professional organizations do that. Integrity, AmeriLife, all of the big people, and some independent agents also hire lobbyists to help advocate on our behalf. There are a ton of people that are doing things to help protect us, and most of them are unsung heroes that you know or that you have no idea are out there doing all of this work. And it's thankless work, actually. So please know that and give some grace when you're looking at that. But are we dead men walking? The answer is emphatically no. How many of you have gone ahead and started in the business after 2008? Sound off in the chat. I want to see that. Okay. So we have quite a bunch of you that are going ahead and that are brand new, because the last major upset in the Medicare world was in 2008. That was the MEDPAC Act of 2008. So, because of that, most of you are freaking out a little bit about the changes and the upset and the disruption that is happening because you have never had something that has shaken the tree as to what has happened in the regulatory world when it comes to Medicare. We're still standing. ACA came out. It did a lot of harm for those that didn't change along with it. And then eventually it moved back to where now people are making money and they're serving their clients and they're growing their business and doing things. So it's had that ping pong effect. The same thing will happen as Medicare goes through additional shifts. You guys cannot, we as a US population or any population cannot have the amount of influx of beneficiaries coming into a system, high cost meds, high cost technology and healthcare costs, and then have it where we have a system that does not have change happen to it. The system we all know is broken. So you have to shift along with that to be able to move. Now, are we advocating for when things go left of center and go, wait a minute, that idea about you going ahead and cutting commissions in the middle of the year or doing it with 2 weeks' notice right before Christmas, that was a crappy move. We need to fix that. Those are things that we look at doing. And NABIP, HAFA, NAFA, several of the other ones have come flat out and said, excuse me, what do you think you're doing? These are things that as you follow those organizations on social media and you watch those press releases, you will see in real time how fast they clap back. The latest one was one that was done to a carrier making an announcement about their plans going non-commissionable. And inside of 30 minutes, NABIP took a stand and said, what are you doing? And inside of 24 hours, that carrier was on the phone to NABIP having a conversation. Many of you don't know that, and now you do. Those that do understand that before, when we attempted to do that a year ago, we were met with crickets. They didn't think that we were formidable and that it was going to be a problem. Now they know that the professional organizations are not going to take this laying down. And that the very thing that CMS says that they do not want, which is steering, now we have proven based on this AEP and all this year, we have now proven that we do what's in the best interest of the client regardless. So therefore, it's not us that are doing the steering, it's the carrier. And now that we have been able to show that, actuarially show that, and sit in front of CMS and go, look, dude, you got the wrong person here. Now they're looking at it and looking at us differently. This is how we've moved the needle. These things don't happen when we're trying to affect change. It does not happen overnight. It happens in slow, deliberate moves. The surveys help us, gave us the ammunition to be able to do these things. That's what you need to understand when you're doing that. The carriers went ahead and killed commission in AEP and throughout this year to stop the bleeding. CMS says you cannot pull your plans off of Medicare.gov. CMS says the carriers cannot pull their plans off of their website and stop telephonic enrollments when they come into the 800 numbers directly to the carrier. So if a carrier has bleeding that's going on, guess where they're going to stop any visibility of those plans? They're going to pull them right off of our quoting tools. Best believe it. Some of them went so far as to come back and say, hey, we're going to make it even harder. You can only go back to the dark ages, which is faxing paper applications. How many of you guys have faxes anymore? I mean, those have been gone over a decade, right? So that's why they did that, is to slow that mid-season because somebody done screwed up. And that is their problem. It is not an our problem. They tried to make it our problem. There is no rule that says that they can't do that. Commissions are, if you read the statement on the commissions information, it says that commissions can be paid up to and not over fair market value. So because of that, that's issue one. Read your contracts, guys, because your contracts by the carrier say that they can make a change or terminate your contract within 30 days. Almost every single carrier does that. So there are no protections that are put into place. And this is what we are shining a bright light on, that, hey, this isn't okay. Make CMS, make them, or Congress, make them put those protections into place for what we do and honor what it is that they had at the time that we sold it. And that's where we're looking at when it comes to that. So, for those of you, if you have not seen the 2026 commission schedule, there it is. I just posted it so that way you can take a look at it. When we go ahead and hold on, I'm trying to clear out some of these that we already answered. So when we go ahead and we look at the commissions are, like I said, they are up to, they include bonus, they include marketing. Marketing money is separate. Most of the carriers aren't doing any marketing money anymore. But um, has there been actuarial proof that the carriers are still getting enrollments for non-commissional plans? Without a doubt. WellCare grew by 1 million enrollees on their PDPs last AEP. So in a plan that they discussed, they ended up saying, well, they're going to have a mass exodus of people because the brokers, the big bad brokers that are only focusing on their $4 a month, are going to go ahead and they're going to pull all this business and put it into plans that are commissionable. Well, guess what? They ate crow because they grew by 1 million members, which emphatically showed that we do not do that. We as an industry do not do that. And that, Sabrina, is how we can drive home the fact that it isn't us that are steering because we're money hungry. It's the carrier that is steering because of the visibility and the access to those plans. Make sense? So when we go ahead and we're going to flip into the next piece of this, which was the question about, um, you know,
The
there was
proposed rule.
the proposed rule. You want to take this one?
The proposed rule said something along the lines of having all of us now submit all of our marketing, all our social media ads, our blog posts, anything related to marketing for Medicare business. Now we are going to have to submit this to CMS. And throughout that whole thing, especially when there was the administration change on the back end, we were at NABIP getting requests for things that we wanted to have doged. And we had an opportunity to say that is feasibly impossible. Like we would wait years to have a response on that. And so it did not get put into the final rule. So you are not going to have to submit your marketing to CMS. And there has been some misinformation spread about that by some influencers on CMS, I understand. And
Right?
we want to just make sure you know you don't have to do that.
Yes. Okay. Dwayne's question, will the carriers pay less for PPO versus HMO? That's very well possible. Because again, they can pay up to, um, but it's better than nothing. So, it may not be full commission, but it's still an option and it's still visible and you're still able to go ahead and help your client. So it's not necessarily a bad thing. And we don't know yet. We don't know what the carriers are doing as far as full product designs, what they look like. Some of the carriers are having their early looks now. We won't know what the actual rollouts are planned for September. They are way later than what they normally are, and they're keeping a lot of that close to the vest as far as what those designs are. But you really need to be aware of some of that. So, will Medicare start putting a stop to the unsolicited Medicare calls and telemarketing enrollment? Why does the government make it easier for telemarketers and harder for in-person agents? So my answer to this one is tune into my Stop the Madness webinar that I'm doing in a couple of weeks. This is a whole 1 hour presentation that I go into the weeds on regarding the FCC versus the versus CMS. There is a program that you can do to go out in your communities and educate how to fight fire with fire. So I would definitely recommend that you tune into that. It is also out on my YouTube channel as a video right now. It is called Make It Stop is the title on it. So feel free to watch that at, at your own discretion, so that way you can hear why and what and the legislative parameters around that. But at the same time, you do need to be aware that, auto dialers and solicitation and, I about died when I saw some of the life insurance FMOs telling agents to rapid dial seniors' phone numbers 9 times before they answer. And when they answer, it was, well, yeah, I know that you're mad that I called you 9 times, but you know what? You're going to be dead soon. So buy some life insurance because you need it. How do you put that on social media? Um, and that's what we're trying to fight. I don't buy inbound leads. I don't buy outbound leads. They are the bane of my existence. And any lead gen company that comes out, I'm like, yeah, I'm not interested. Which I get that I am the anomaly to that, but most of those lead gen companies, they want to sell you something, guys. They want to take your money. So, of course, they're going to tell you and lie to you that they are doing compliant lead gen. Most of them aren't. Hear me when I say that. So, because of it, be very, very careful, because any lead that you obtain, whether it's a live transfer lead, however you're getting those, you must comply, and you are the one that holds the bag for any non-compliance when it comes to that lead. Not the lead gen company. The
So you need to be
company that
asking a
you
lot of
spend money
questions.
for, they don't have anything that happens to them. Not even a slap on the wrist.
So when you're choosing lead vendors, if you're doing that, these should be some of your questions. How do they prevent that? Like you need to be involved in in that decision. I know we at Boomer Benefits years ago, we stopped buying leads. We drove all of our marketing dollars into getting people to go directly to our website and call or message. And so we don't do any of that anymore. But it was very vital to us in the early days of our business, and they can still be something you use, but you need to be asking very pointed questions about that up front so you don't get in trouble.
Yes. So, for those of you asking, my YouTube channel is Insurance Unfiltered with Amanda Brewton. If you just type in my name, you'll find it. It's a 2-second one to go ahead and do. Yes, we are still customizing those brochures that you use if you take the course. So, and no, I won't tell you how to use the brochures because it's in the course. So there's that's how you would get, that's how that's done. Renee, give me a couple more seconds. We've got 2 more slides and then and in regard to those topics. So the course is the Make It Stop course that we're talking about with the unsolicited calls. So I have a webinar coming up in a couple of weeks for it, and it's called Make It Stop. You can find the Facebook event that's out there. It's also posted on social media. It's on my website. If you want the live training, which is in a couple of weeks, if you want to watch the video is on my YouTube channel. And that video is the title of it is Make It Stop is the name of that. So, what are some of the best practices to continue to grow and retain your book of business? You want to go ahead and take this one?
Sure. This really hasn't changed, guys. It's the same ways that we have been doing business. And if you have yet to modernize, then that would be the area that I would suggest you go. So you need to get visible online. You need to be able to be doing content marketing and social media presence. These are huge. I'm a member of HAFA, and I'm going to be doing an educational webinar on this the first week of August for HAFA members about how I got started marketing Boomer Benefits online. Of course, obviously getting involved in NABIP and another association so you can stay up to date on the trends. But also, I often share with our clients or prospective clients that we're a member of a professional association, because bad actor agents don't invest money into an association to learn and be good at what they do. And so I'm always sharing about my association relationships. You can stay in touch with your clients easier than ever. Now you have AI to help you with your quarterly newsletter or check-ins, which can be done via SMS even. This is, again, things you can automate in your business. Ask for referrals on every sale. I have an agent in my office that has the very lowest conversion rates and takes very few leads from us at all because he asked for referrals on every single sale. So he's always working referrals that he got. This is something we did in the early days. Also, making sure you're X-dating those conversations so you can come back to those people later. You also want to encourage online reviews. I mentioned earlier, people ask me all the time, how do you get so many reviews? We ask for them after every, hey, did we do a good job? Would you mind going? I'm going to send you a link. Could you leave us a review? You want to make sure that you have a good CRM in place so that you can automate things like appointment reminders and policy renewals so that you can be out in the field driving business. If you're not going to purchase leads, then you're going to have to drive them. And all of those grassroots things, they still work. You can host local seminars and educational events, and those efforts are still great ways to get in front of people. There are a lot of agents out there still doing business that way. And then one thing I wanted to mention is, have you ever considered targeting a niche? Because anytime you can niche down and concentrate and be special at one thing, this gives you tons of marketing for that one thing. So maybe you decide to niche down and your focus is going to be on veterans and the products available for veterans. Maybe you focus and you do D-SNP. I know a couple of great agents, and that's almost all the business that they do, and they're experts at it. And in fact, I have referred them tough DE cases because we don't write much of that. You could focus on snowbirds, on nurses, on teachers. There are I have a couple of employees who are teachers, and they are great agents. If you wanted to specialize in that and say that I'm a former teacher and now I'm going to teach you Medicare, I know a couple of great agents out there that do that. Chandra is one. There's a couple of them out there. Why not in your area be the one that's just the expert and you become known for that's a particular group of people that you specialize in? Not that you don't write the business elsewhere, but that you do. One of the things I think that vaulted our success early on was just thinking about like how could we take the service level to a whole different stratosphere? Like not every agent provides some level of service, or at least the good ones here do. But how could we go absolutely beyond every possible expectation and blow our clients away? And then we hung our hat on that, and we've been focusing on that ever since. And I have 75 people on my service team that only work on existing clients, and it gets us a ton of business. There's 100 other things that you could become the person that's really good at that. And all of that type of stuff drives business. But if you are a grassroots person and you have yet to start doing some of the online marketing, you really do need to get involved in that because this is how people are buying insurance products these days. And there's a lot of focus on finding Medicare agents through those social media channels. So it's important for you to have some sort of presence there.
Actually, that's it. Okay. So we do have, I'm going to actually stop that presentation. Because you want to know how to register for the Make It Stop course. So what you're going to do is go here, and I'm going to pull this link for you in 2 seconds once it loads. I got to move some of this stuff out of my way. There it is. So this is the actual, here is the link to go ahead and register for this particular class for that one so that you're good to go. Okay, so there are a few things here that just to end and to talk about a few things. What's the best way to start up a website? I would highly recommend that you don't do one yourself. I would look at companies like Ken French and Snoozy, or Agency Block, or Go High Level, or any of the other ones that actually have services that can do your website. I would recommend that you investigate those. Ken French and it is who I use. With he specializes in it, and there's a lot of regulation concerning what you can and cannot do online. So I recommend that you look at that. That's one of the things that I would definitely recommend. Social media is something that happens over time, guys. It is not something that you do and you post two things and you got 1,000 people that are watching your stuff.
Yeah,
That is not how social media works.
right.
You have to be consistent with what you're doing in order to make that happen. Um,
And it would take you years sometimes to
yes,
get that traction going. So I hear from agents all the time, well, I posted something and I got no likes. Okay.
right.
First of
Well,
all,
that's
there's a lot of
okay.
people lurking on social media that don't interact, they just watch.
Mhm.
So you don't know who's watching that. But
Yes.
that consistency may have to happen for a number of years before you get traction. I remember that. I remember putting out videos and early content and just get hearing crickets, but that's not how it is anymore. But we just have to be dedicated to it long term.
Other questions. I had a couple of people that said, with the Make It Stop and the unsolicited calls, do you need to attend again? Has there been any updates? Not really. There's been traction on it, but then it got thrown out of court. So, that with the regulation, so it's just ping pong. So still do what you're doing because we're still bringing attention to it. But that's really it. Are you allowed to email leads that purchase from lead companies? You can email and mail, but you have to have an opt out on the email in order to go ahead and be compliant. So, so yeah, that is. So I think that we've got 12 minutes. Let me see what else we've got in here. Um,
Also, there's a lot of influencers in our space that are members of professional associations.
yes.
So get involved in Facebook groups like Amanda's because you're going to meet other producers there. I've been in this business a long time, and I frequently still learn from agents that are actually younger younger than me, or people that I didn't know until quite a ways down the area of my business. And I'm not afraid to go out and seek those people. You can find out a lot in those places, and there's courses for some of you that are new. If you're just getting in investing or just getting start your feet wet in AI, Victoria Cabrera has a great program for AI, and then don't
Yep.
forget the Udemy. So if you
She's
want to
actually
follow,
speaking at Ms. Medicare next year.
oh
So
yay! So
I'm
I
super
I
excited on that
actually
one.
follow her stuff and have watched her videos, and she does a weekly call. So I
Hmm.
would totally I would just encourage you to find other people in our professional associations. First of all, join if you haven't joined, please join one. But then seek out other agents who are like us and you who care and who are serving the market in those ways. It's a great way for you to learn things from other agents, even if you have been in the business longer than those people. Sometimes you're going to have people that come up behind you and they're just better than you at things like that. It's just like in my business when I started off doing all of our social media, I got all my feet wet. I learned how to do it myself, so I'd always be able to answer questions. And then I went out and hired the best person who was 10,000 times better than me to come in and run that in my business. And it's the same way for stuff like this. Find other agents that are offering the education that you need and work with them so that you can get up to speed.
So Victoria's last name is Cabrera. I've put it in a couple of times in the chat. If we're only able to join one or two groups that you mentioned, what would you recommend? So here's a couple of things when you are looking at social media people and people that post stuff. One, make sure that they cite their sources. Um, Make sure that you are looking at that. Victoria is on Facebook, without a doubt. And she's actually in a couple of my groups. So you should be able to find her real quick, because we're connected. Um, so just because somebody says something with conviction does not necessarily mean that they actually know what the hell they're talking about. I can't stress that enough. So when you are going ahead and you are following people, make sure that they can tell you where they're getting their information from. Make sure that they have a history of providing good information. I had a conversation yesterday with somebody and they were following someone else on social media. And the comment was, well, that person's a part of the Medicare advisory group. Haven't they been on that? And I literally laughed and said, no. They took some pictures with those people that are a part of MAG, but that's not them. And the fact that they're posing as though they are, that's a problem with their integrity. So please watch what you are doing when it comes to that. If you can only be a part of one of the professional organizations, great. It's 20 bucks, 30 bucks a month. You can afford that. Let's be real. You can. It is the number one best thing that I have done for my career, exponentially above everything else that I have ever done. So that's the first thing. When it comes to Facebook groups, I run four, three, four at this point. But at the same time, if you don't like those, then go ahead and there's many other ones that you can do. Danielle has one for beneficiaries. I don't know whether or not you let agents in there, but
Mm-mm.
um no, but there's other ones that are out there. And if you want additional content, like I said, you want to make sure that you are following on LinkedIn. Who do you follow on LinkedIn? There's a whole host of people. So every morning I wake up, I read for 30 minutes. The first thing that I'm reading is what's on LinkedIn because there are articles that someone has found that I need to read, studies that have been published that I need to take a look at. There are people that I follow that are CMS people, legislators. There are carrier reps, presidents of carriers. Those are the people that I follow, and that's what allows me to stay up to date so that I can talk competently to anyone about what is happening. So for your development, for your professional development, here's my recommendations for you. One, get involved with a professional organization. NABIP, HAFA, pick one. I don't care. Two, attend Medicarians at least once so that way you can get some information both on the Medicare side and the ACA. You can get a free ticket for that. The dates for Medicarians are April 20th to the 22nd. I'll even do you one better because you can get a free hosted ticket by using the link that I'm going to put in the chat box. So register, and then all you have to pay for is your hotel and your flight out there. It will do you good to know what else is out there in the industry and available. The next one is you need to attend CapCon. You need to do that so that you can understand how things work and you can actually have it shake you to the core because this is so much bigger than you and your agency in your city. And you need to be able to see that. And you need to be able to take that back home with you with new eyes to be able to then grow and further your career. The last thing that I would say is that don't just stand on the sidelines, guys. You are not a victim of what is happening. You have the ability to change what is happening, and it is not someone else's problem. I don't get paid a dime to go advocate on your behalf and take all the meetings and the hours of research and all the things. Neither does Danielle, neither does Jalen, or any of the other people inside of these organizations that donate their time to protect all of us. So, one, say thank you. And two, we are now asking you for your help. Send out the surveys. Those surveys help us do the heavy lifting for all of us. Put it in your workflows as a thank you when you are due after you do a meeting. And then that client is going to give back, but then that helps us help you. So I'm going to put that link again regarding the surveys. And if you need a sample of what you can email your client because you don't know really what to say, we can do that too. So that's what I would definitely say. Do you have anything else that you want to add?
The last thing I would add is I feel so much fear out there in the market right now. And Amanda mentioned earlier about the NIPA 2008 changes, but I remember one even earlier than that. Back in 2001, AARP had a product called Secure Horizons, and that thing went into the marketplace, and then they didn't make money, and they dumped all the people off the market. And when I first joined the industry, was just learning Medigap. A lot of the old timers said, "Don't learn it was called Medicare Plus Choice back then. Don't learn Medicare Plus Choice. Never gonna work." I enrolled all these people, and they got dumped, and I was like, I bet that will come back around. And so I did go ahead and get contracted with carriers that were still offering those products. Sure enough, later they started coming out with them, and now it's a huge thing in the marketplace. So these shifts will happen sometimes, and I would be willing to say that if you can weather the next 2 to 3 years in this business and come out the other side, you will be one of a small group of people that are still standing to reap the rewards on the other side. So don't panic. I know that feeling and I understand where it comes from, but just know that I'm sleeping good every night and I'm not worried. I'm not worried that my career is going away, and I will pivot if I needed to. So when you feel fearful about that, please remember that they can't help 67 million people without us, but there may be some changes that we have to weather in the meantime, and it's all going to be okay. So thank you guys for being here. Super fun to chat with you. We love doing stuff like this, and just a great group of people in the comments. So we appreciate all the thank yous. You're very welcome.
Thank you all. I hope that this eases your mind. Please put the feedback on my Facebook page or get it to me and Danielle. So I hope you feel better or a little bit better after spending 2 hours with us to try to dispel some of this. If you want to help us, tell other people to follow both of us. That helps us help you. The more that we can get the word out, the more that we can tell people about what's going on and we can be a source of truth for them. Have them follow us on social media. That helps us further the cause when you go ahead and you do that. But you can watch this on replay and share it. It will be on my YouTube shortly. But outside of that, feel free to reach out and I hope to see you all soon. So thank you. I will be Florida people. I will be at the Florida Summit. Actually, I fly out Saturday and then I've got the Des Moines Summit and then I've got the Senior Summit in California and then I'm done I'm off the road.
Does anybody
So
remember the Today Show
yeah,
that used to have this Where in the World is Matt Lauer? Like, this is the
it's
game you should
me.
play with
It
Amanda.
is
Where in the
me.
world is Amanda
Yeah,
Brewton today?
it is
We should
me.
give out
So
prizes for that.
yeah. It's awesome. So thank you all for attending. We appreciate you and we will all talk soon. So thank you.
Bye, everyone.
Nice job.
Woohoo. Okay. That was great. Lots of great questions.
We held, we peaked at over 1,000 people. For the first hour, we were over 1,000 people
Wow.
nonstop. And
Yeah.
then we didn't drop below 900 until 15 minutes ago.
Wow. That's
I'll
crazy.
take it.
Oh, Robert says he can still hear us.
But look, I got a new shirt.
It's all good. 1,000 people. That's awesome, you guys. Thanks for being here.
Yeah. So awesome. Have a good one, hon. I will talk with you later. Thank
Okay.
you.
Bye.